Anatomy and Physiology, the Respiratory System, Things You Should Know, Questions and Answers, by Rumi Michael Lee. Introduction. I would like to thank and congratulate you for listening to this book, Anatomy and Physiology, the Respiratory System, Things You Should Know, Questions and Answers. This book will help you understand, revise and have a good general knowledge and keywords of the human respiratory system. Part 1. 1. What is intra-alveolar pressure? Intra-alveolar pressure is pressure in the pulmonary alveoli. 2. What is intrapleural pressure? Intrapleural pressure is pressure in the pleural cavity. 3. What are the 4 respiratory volumes? The 4 respiratory volumes are the tidal volume, inspiratory reserve volume, expiratory reserve volume and residual volume. 4. What are the 4 breathing capacities? The 4 breathing capacities are vital capacity, functional residual capacity, inspiratory capacity and total lung capacity. 5. What is the anatomical dead space? The anatomical dead space is the volume of air in the conduction zone. 6. What is hypoxia? Hypoxia is an insufficient amount of oxygen brought to the organs by the blood. 7. Does the volume of air in the conduction zone contribute to gas exchange? No, the volume of air in the conduction zone does not contribute to gas exchange. 8. What is pulmonary emphysema? Pulmonary emphysema is the destruction of the alveoli. 9. What is pneumonia? Pneumonia is the accumulation of liquids in the alveoli. 10. What is emphysema? Emphysema is excessive and permanent pressure in the lungs. Part 2. 1. What is the pulmonary hilum? The pulmonary hilum is the place where nerves, bronchi stem and blood vessels pass. 2. What is pleura? Pleura is what surrounds and protects the lungs. 3. The pleura is rich in? The pleura is rich in elastic fibers. 4. What is hemothorax? Hemothorax is the accumulation of blood in the pleural cavity. 5. What is pleurisy? Pleurisy is the accumulation of pus in the pleural cavity. 6. What is partial pressure? Partial pressure is the proper pressure of each gas. 7. What is tidal volume? Tidal volume is the volume of air exchanged. 8. What is bradypnea? Bradypnea is a very slow respiration. 9. What is tachypnea? Tachypnea is a very fast respiration. 10. What is hypercapnia? Hypercapnia is when there is too much CO2 in the blood. Part 3. 1. What is hematosis? Hematosis is the external breathing between air and the blood. 2. What is phlebitis? Phlebitis is when a clot blocks the venous circulation. 3. What is surfactant? Surfactant is a liquid that reduces the tension between the alveoli. 4. What is apnea? Apnea is the stop of a brief moment of breathing. 5. What is eupnea? Eupnea means normal breathing. 6. What is chronic bronchitis? Chronic bronchitis is the accumulation of mucus that blocks the airways. 7. What is asthma? Asthma is the spasm of the bronchioles that narrow the airways and makes breathing difficult. 8. What is diaphoresis? Diaphoresis is excessive sweating. 9. What is Cheyne-Stokes? Cheyne-Stokes is respiration of great amplitude with periods of apnea. 10. What kind of people have Cheyne-Stokes? children and the elderly. 11. What is the respiratory membrane? The respiratory membrane is the barrier where there is gas exchange. Part 4. 1. What is epistaxis? Epistaxis is hemorrhage of the nose. 2. What is orthopnea? Orthopnea is when a person cannot breathe while lying down. 3. What is otorhinolaryngology? Otorhinolaryngology is the branch of medicine that studies and treats pathologies of the nose, ears, and throat. 4. What is the function of the nose hairs? The nose hairs protect the respiratory tract against dust and microbes. 5. Name 2 types of mucous membranes. The respiratory mucosa and olfactory mucosa. 6. What is the function of the respiratory mucosa? The respiratory mucosa moistens and heats the air. 7. What triggers the sneeze reflex? Substances in the air that irritate the lining of the respiratory system. 8. Do blood vessels contribute to the warming of the breathing air? Yes, blood vessels contribute to the warming of the breathing air. 9. What is the function of the oropharynx? The oropharynx allows the passage of food and air. 10. What is the function of the tonsils? The protection and destruction of pathogens. 11. What covers the pharyngeal mucosa? The respiratory mucosa. Part 5. 1. What is called the Adam's apple? The larynx. 2. What constitutes the larynx? Bone and cartilage. 3. What is the function of the pharynx? The pharynx allows the passage of air, food, and aid phonation. 4. What is the function of the trachea? The passage of air to the bronchi. 5. What is the function of the carina? The carina ramifies the trachea into 2 main bronchi. 6. Do respiratory bronchioles consist of walls with glands? No, respiratory bronchioles do not consist of walls with glands. 7. What is the function of the pulmonary alveoli? The pulmonary alveoli allow gas exchange. 8. What is the mechanism that allows gas exchange? The mechanism that allows gas exchange is dissemination. 9. The pleura contains how many sheets? The pleura contains 2 sheets. 10. What are the 2 sheets of the pleura? The 2 sheets of the pleura are the parietal pleura and the visceral pleura. Part 6. 1. Is there a positive or a negative pressure in the pleura? There is a negative pressure in the pleura. 2. What is the function of the pleural fluid? The pleural fluid protects against the friction between the 2 layers of the pleura. 3. What is the main breathing muscle? The main breathing muscle is the diaphragm. 4. What are the functions of the respiratory system? The functions of the respiratory system are respiration, gas exchange, phonation, olfaction, and acid-base balance. 5. What does air contain? Air contains approximately 79% nitrogen and 21% oxygen. 6. What is atmospheric pressure? Atmospheric pressure is the pressure of the air that surrounds us. 7. What is the factor that determines the movement of a gas? The pressure gradient. 8. What are the types of active respiration? The types of active respiration are normal inspiration, forced inspiration, and forced expiration. 9. What are the types of passive respiration? The type of passive respiration is normal expiration. 10. Tidal volume measures. Tidal volume measures 500 milliliters of air. 11. What is the inspiratory reserve volume? The inspiratory reserve volume is the volume of air formed during forced inspiration or expiration. Part 7. 1. What is residual volume? Residual volume is the volume of air that remains in the lungs even after forced exhalation. 2. What is vital capacity? Vital capacity is the volume of air required for gas exchange. 3. What makes it possible to measure respiratory volume? A spirometry. 4. What are the two types of pulmonary ventilation? The abdominal and thoracic ventilation. 5. What are the four regulatory mechanisms? The autonomic nervous system, the cerebral cortex, the mechanoreceptors, and the chemoreceptors. 6. What is the function of the automatic breathing center? The automatic breathing center adapts the respiration to the body's need. 7. What is cyanosis? Cyanosis is insufficient oxygenation. This is evidenced by a blue coloration of the skin. 8. What is dyspnea? Dyspnea is difficulty in breathing. 9. Why is it that we cannot hold our inspiration for long? We cannot hold our inspiration for long because there will be an accumulation of CO2 in the body, and it becomes too acidic for the body, and then O2 is needed. 10. What allows conscious control of pulmonary ventilation? The cerebral cortex. 11. Can the respiratory system function alone? No, the respiratory system cannot function alone. Part 8. 1. What does the body temperature show? The body temperature shows the metabolic activity of the organism. 2. Name the two types of body temperature. The central temperature and body surface temperature. 3. Where is the central temperature? The central temperature is located in the skull, the thoracic cavities, abdominal, etc. 4. Where is the surface temperature? The surface temperature is located in the skin and adipose tissue. 5. Which of the body temperature is higher, the central temperature or the surface temperature? The central temperature. 6. Name some factors of body heat production. Muscular activity, basal metabolism, thyroxine, etc. 7. Name some factors of body heat loss. Conduction, convection, radiation, and evaporation. 8. What is conduction? Conduction is the loss or gain of heat by direct contact. 9. What is convection? Convection is the loss or gain of heat by displacement. 10. Which is a better conductor of heat, air or water? Water is a better conductor of heat than air. 11. What are the mechanisms of thermoregulation? The mechanisms of thermoregulation are thermogenesis and thermolysis. Part 9. 1. What are some factors that can influence the central temperature? Age, hormones, physical and mental effort. 2. What is hypothermia? Hypothermia is a high body temperature, beyond the normal body temperature. 3. What is the average temperature of an adult at rest? The average temperature of an adult at rest is 36.8 degrees Celsius. 4. What is hypothermia? Hypothermia is a low body temperature, below the normal temperature. 5. How is breathing measured? Breathing is measured by its frequency, rhythm and amplitude. 6. What is the respiratory rate? The respiratory rate is the number of the respiratory cycles per minute. 7. What is the respiratory rhythm? The respiratory rhythm is the regularity of respiration. 8. What is the respiratory amplitude? The respiratory amplitude is the amount of air inhaled and exhaled at each respiratory cycle. 9. What is the respiratory rate in a newborn baby? The respiratory rate in a newborn baby is between 30 to 40 breaths per minute. 10. What is the respiratory rate in an adult? The respiratory rate in an adult is between 12 to 20 breaths per minute. 11. Which phase is longer, the inspiratory or expiratory phase? The expiratory phase. Part 10. 1. What is the use of saturometry? Saturometry is used to measure oxyhemoglobin. 2. The result of saturation is obtained in percentage. 3. What is the normal result of the capillary blood oxygen saturation? The normal result of the capillary blood oxygen saturation is more than 92%. 4. What is the result of oxygen saturation below 92%? Oxygen saturation below 92% may reveal hypoxemia. 5. Which nerve stimulates the diaphragm? The phrenic nerve. 6. What type of cartilage does the epiglottis have? The epiglottis has elastic cartilage. 7. What is the function of the palate? The palate separates the oral cavity from the nasal cavities. 8. What are alveoli? Alveoli are small bags in the lungs that allow gas exchange. 9. What is the function of the epiglottis? The epiglottis closes the airways and allows the passage of liquids and food in the digestive tract. 10. What is phonation? Phonation is the ability to produce sound. 11. What factors can influence the production of sound? The structures of the nasal cavity, the buccal cavity, pressure and tension. Part 11. 1. What supports the trachea? The trachea is supported by series of cartilaginous ring. 2. Which of the lungs is smaller? The left lung. 3. Why is the left lung smaller than the right lung? The left lung is smaller than the right lung because it must leave room for the heart. 4. Which of the lungs is shorter and why? The right lung is shorter so that the diaphragm can cover the liver. 5. The right lung has how many lobes? The right lung has 3 lobes. 6. The left lung has how many lobes? The left lung has 2 lobes. 7. Name the 3 types of bronchi. The 3 types of bronchi are the primary, secondary, and tertiary bronchi. 8. Each lung contains how many alveoli? Hundreds of millions of alveoli. 9. Give another name for the primary bronchi. The primary bronchi are also called stem bronchi. 10. Give another name for the secondary bronchi. Another name for the secondary bronchi is lobe bronchi. 11. Give another name for the tertiary bronchi. Another name for the tertiary bronchi is segmental bronchi. Part 12. 1. During normal exhalation, what happens to the muscles? The muscles relax. 2. During forced exhalation, what happens to the muscles? The muscles contract. 3. Which muscles relax during normal exhalation? The external intercostal muscles and the diaphragm. 4. Which muscles contract during forced exhalation? The internal and intra-abdominal muscles. 5. What regulates the respiratory rate? The spinal bulb. 6. Name the structures of the upper respiratory system. The nasal cavity, the pharynx and the larynx. 7. Name the structures of the lower respiratory system. The trachea, the bronchi, the bronchioles and the lungs. 8. What is the function of type 2 pneumocytes? The production of the alveolar liquid. 9. Which muscles are used during forced inspiration? The sternocleidomastoid, the scalene and the external intercostal. 10. Which muscles contract during normal exhalation? None of the muscles contract during normal exhalation. 11. Which muscles compress the trunk when we are forced to exhale? The abdominal muscles. Part 13. 1. What is the name of the double membrane that surrounds the lungs? The pleura. 2. Lungs have what kind of muscle? Lungs do not have muscles. 3. What is the organ that allows us to speak? The larynx. 4. What property of the structure of the lungs makes breathing possible? The elasticity of the structure of the lungs makes breathing possible. 5. What are the two circulations of the lungs? The bronchial circulation and the pulmonary circulation. 6. What is systemic blood? Systemic blood means oxygenated blood. 7. What is pneumothorax? Pneumothorax is when air enters the pleural cavity. 8. What is partial vacuum, negative pressure, within the pleural cavity? Partial vacuum within the pleural cavity is due to opposing forces acting on the visceral pleura and the parietal pleura. 9. Name 3 modes of transport of CO2 in the blood. The 3 modes of transport of CO2 in the blood is in the form of bicarbonate ions in the plasma, in the form of hemoglobin in erythrocytes, and in dissolved form in the plasma. Part 14. 1. What is the most powerful stimulus of breathing? The most powerful stimulus of breathing is carbon dioxide. 2. How many cartilages form the larynx? 8 cartilages form the larynx. 3. What type of cartilage forms the larynx? Hyaline cartilage. 4. What type of cartilage forms the epiglottis? Elastic cartilage. 5. What type of breathing takes place when you have asthma? Superficial breaths. 6. Why do we hyperventilate? We hyperventilate because the body urgently needs oxygen. 7. How is the amplitude of breathing evaluated? The amplitude of breathing is evaluated from normal, deep, or superficial. 8. Which lung has an oblique fissure? The left lung. 9. What is the relationship between oxygen supply and blood pH? An increase in oxygen in the blood increases the pH of the blood. 10. What is the relationship between CO2 and the respiratory rate? CO2 increases the respiratory rate. 11. Which vertebrae do we find the trachea? We find the trachea in the vertebrae T05. Part 15. 1. What is the function of the parietal pleura? The parietal pleura covers the chest wall. 2. What is the function of the visceral pleura? The visceral pleura covers the lungs. 3. Why does the air not change completely within each breath? The air does not change completely because of the conduction zone. 4. What part of the encephalon allows voluntary breathing? The cerebral cortex. 5. What part of the encephalon allows involuntary breathing? The spinal bulb. 6. Why do the lungs retract on themselves? The lungs retract on themselves because their fabrics are rich in elastic fibers. 7. What is the length of the trachea? The length of the trachea is 10 to 12 centimeters. 8. What are the functions of the bronchioles? The functions of the bronchioles are bronchomotricity and air conduction. 9. What are the basic structures of the lungs? The alveoli are the basic structures of the lungs. 10. What are the roles of type 1 pneumocytes? Type 1 pneumocytes allow external respiration. 11. What does the alveolar epithelium contain? The alveolar epithelium contains type 1 and type 2 pneumocytes, macrophage and elastic fibers. Part 16. 1. What is the cell stage? The cell stage is cellular respiration. 2. What is the tissue stage? The tissue stage is the internal breathing. 3. What is the blood stage? The blood stage is the transport of oxygen and carbon dioxide through the blood. 4. What is the function of mucus cells? The function of mucus cells is warming and humidification of the breath. 5. What separates the nasal cavities? The nasal septum. 6. Where are tonsils found? Tonsils are found in the nasopharynx and in the oropharynx. 7. What kind of mucous membrane does the trachea have? A ciliated mucosa. 8. Tuberculosis is what type of infection? Tuberculosis is a bacterial infection. 9. What is the role of nitrogen in the air during respiration? Nitrogen has no role in the air during respiration. 10. Which bone advances during inspiration? The sternum. 11. Which cells allow us to discern different odors? The olfactory cells. Conclusion. Thank you once again for listening to this book. I hope it has helped you in your journey to understanding the respiratory system of the human body.